Alright, so now we're moving on to the care portion of the trachea. So after suctioning it, you're going to look at the stoma dressing and you're going to assess it for coca, color, odor, consistency, and the amount of liquid that might be on the drainage or on the dressing. So we're going to remove this, and again, we would assess it if there were anything on the dressing, and we'll discard of it. And then they also want us to remove our gloves and throw away the suctioning tool that I talked about last video. After we remove these gloves, we're going to perform hand hygiene and then open our sterile tracheostomy care tray. Okay, so opening my care kit. This would normally be done on a side table. And then we're going to throw away any extra pieces. Make sure we maintain our sterile field. We're going to place this, open it, and place it upon our patient. This is just too big for her. Alright. And then I would put on sterile gloves if I have them, but I'm just having to reuse these gloves again. Starting with our dominant hands. Then our non-dominant hand we would use to pour saline into our basin. I don't even think this came with several basins. It didn't. We would pour sterile saline into our basin. We're going to moisten these little applicators, so we'll set them in there. There's 3 of them, I think. No, there was just 2, so we would set these in there. Alright, and then this was my mask, so I would have removed this from the trachea. And then I would then unlock the inner cannula and remove that piece from there. This doesn't come with a new one to insert. But you would turn it and make sure it was locked and secured in the correct position. Then we're going to, after these are all moistened, we will use them to clean around the stoma site, and we would move around and then outward. So we would do that once outwards per swab. So then it wants us to moisten these pads and continue to clean them, throw them away, and then also pat dry around using our sterile glove, and throw these away. And then once it's clean and dry, we're going to use my non-dominant hand that is not with the glove. I'm going to hold on to the trach and put a new dressing in place. In the example videos that we had, we were able to use tongs to move it forward rather than our hand. And then we would use this to tie around, and you're going to secure that to the neck around and secure the trachea. If we had a stoma in place, the plastic piece that holds it in place, we would secure it, but we wouldn't want to make it too tight where it feels like it's choking them. Yeah, it says to place 2 fingers underneath to make sure it's not too tight, and then you would, afterwards, you would have this in place before you remove the old ties, which these would have been there before, so we would have removed them after the new ones were in place to make sure that the trach stays where it needs to be and does not come out. We would discard those ties, perform hand hygiene, throw away of all of our supplies that we use today, perform hand hygiene, make sure that our patient's bed is locked, call light is within reach, bed rails are raised, they have anything they need, you reassess the patient, make sure that the suctioning and the care that you did perform has done its job and that your patient is comfortable. They're not having to use any accessory muscles or anything extreme to breathe. This has helped them, hopefully, and just reassess their pain level or if they need anything else before leaving the room. Okay.